today is anatomy. Am I right? Or is labor? Hello, good afternoon, everybody. Good afternoon, ladies and gentlemen.
Good afternoon, sis.
Good. We have anatomy. Am I right?
Yes.
Yes, please.
Okay. I think we are done with the vulva, and then it's left with the vagina, right?
Yes, sister.
Okay. So let somebody describe the vagina. I need to know your previous knowledge. Then I will base on it, and then we move on. So quickly, quick one, the vagina. Whoever is describing the vagina, please, I want to know your name and whatever you know about the vagina, just say it, please. Vagina. Good afternoon, Mom. Good afternoon, everybody. Yeah, please, who is ready to describe? Say something that you know about the vagina, and then we can move on quickly. Today, we have to finish with the service and even to the uterus. So,
Sister Deborah Mensah.
Auntie. Okay, Deborah Mensah, please go ahead.
Vagina is a canal standing from the vulva to the cervix.
Good. Okay.
It is between the vulva and the cervix.
Okay.
It runs upwards and backwards to the cervix. And the posterior wall is about 10 to 11.5 centimeters, while the anterior wall is 7.5 centimeters length.
Okay. Thank you very much. You say her name is what?
Deborah Mensah.
Deborah, thank you very much for opening the floor for me. Yeah. Let me quickly take it now. The vagina. I know before you came into midwifery, it's like it was the vulva that people were referring to as the vagina. But now that you know that vagina is one of the internal organs of the female reproductive system, you know it already. So the vagina, it is a potential canal. It's a canal. It's a tube. In fact, it forms the beginning of the Mullerian duct. You know, the Mullerian duct is a duct that extends from the introitus, the vagina. It's a tube that moves upwards during intrauterine life, so that the entire Mullerian duct is tubular in shape. But then as the development of the fetus develops, then the parts will start separating so that you see the uterus expanding, the fallopian tubes adding up, that kind of thing. So that is it. Then later, all the structures will be formed. Kwaku, Auntie is here. Sister Pacho friend, Auntie is here. Come. So I'm saying that the vagina forms part of the Mullerian duct, and it is tubular in shape. It is tubular in shape, and other books say it's a potential canal, where potential means it's capable of expanding, it's capable of coming together. The walls can be in opposition to each other. Sister, I'll be able to get the use of a carbon. To get now the Friday and I can't so on in your baby. May child be this already said on. Also, I started the deal. Maybe cousin of need means my background, yes. Please forgive me. So I'm saying that the vagina is a potential tube or a canal that extends from the vulva to the cervix. To the cervix. And in fact, the cervix has a way of projecting itself into the vagina. The cervix, it projects into the vagina at a right angle so that you have a posterior wall and an anterior wall of the vagina. The anterior wall, in fact, is shorter than the posterior wall because of the projection of the cervix at a right angle, so that the anterior wall will measure 7.5 centimeters in depth, whilst the posterior wall, being longer, will measure 11.5 centimeters. Please, I hope it's clear. Can I continue? Ladies and gentlemen, can I move on?
Yes, sister.
Yes, sister. Please, you can.
Okay.
Yes, sister.
Okay. Then, after the measurement, after getting this measurement, let's look at the introitus. Let's look at the introitus. Introitus is the same as the vagina entrance or the vagina orifice. That is the introitus. So the vagina introitus is covered with a thin membrane which is perforated in the center. It is take it. Let's give it to Auntie to open for you. Oh, it's inside. So I'm saying that the entrance of the vagina, that is the introitus. In fact, the introitus takes about 3/4 of the entire vestibule. It takes a greater portion of the entire vestibule. Now, this hymen is perforated in the center, or it is opened in the center to allow for menstrual flow when the girl grows up, when the girl reaches puberty. It is this perforation or this canal that will allow menstrual flow to come out. In the same vein, it also allows for penetration of the penis during sexual intercourse. That is the introitus into the vagina. I hope it's clear. Okay. Can I continue? Please,
Yes,
we are not seeing our faces.
Yes, sister.
So if I ask and nobody responds, I presume that you do understand, then I will continue. If somebody said, yes, somebody said, can I take it? Did somebody say, can I take it again? Which aspect do you want me to take again?
HAJIA, where you said it's covered by a thin membrane.
Okay. I said the introitus is covered by a thin membrane, which is opened in the center. And the function is that it allows for menstrual flow or the product of conception to come out when the girl grows up, becomes pregnant. Then, it also facilitates the insection of the penis or the introduction of penis during sexual intercourse. That's the essence of that opening in the vagina introitus. Okay. Now, let's link it. Let's relate it to midwifery. In midwifery, midwives are expected to do general examination of the newborn baby, including examination of the vulva, to make sure that this hymen that we are talking about is naturally perforated. Because in some babies, the hymen is not perforated. We call it imperforate hymen. That is congenitally, that is how it looks like. But it has its disadvantages. The two functions that we are talking about will be inhibited. So that when the girl reaches puberty, she cannot menstruate if she's having imperforate hymen, which the midwife didn't examine her. The midwife who conducted the delivery didn't examine her. And so she has grown up with it. So it is a responsibility of the midwife to ensure that the hymen is perforated in the center. Now, okay, in a situation where the hymen is not perforated, And the midwife also refused to do examination of the newborn, and the girl grows up with it, what happens is that she will start menstruating. Sometimes they go to secondary school and still she's not seeing her menses. Meanwhile, she's menstruating. So she will menstruate from the uterus, then it will come and occupy the vagina. Every month she will menstruate, it will come and fill up the vagina. And we call that one hematocorpus. Hematocorpus. C-O-L-P-U-S, corpus. So that is, it's an abnormal situation. Meanwhile, if the midwife, the one who conducted the delivery, if she had taken her time to examine the baby, including the examination of the vulva, she would have noticed that the hymen wasn't perforated. So those of you who don't examine, please try. If you don't know how to examine, call a colleague to find out from you. To help you to examine especially this issue that you are talking about, so that you can prevent the girl from getting the hematocorpus. Who said page number? Which page are we talking? Which page are you talking about? I don't have any page here. I've already given you the slides. This thing that I'm talking about is not part of the slides. It's not there. But I'm sharing it with you. I'm not looking into any slide, please. So if you say the page number, there's no page I can give you now. Unless somebody, if one of you have seen it in the distance, in the slides. Let's show the slide. You show the slides, but I will still speed up so that we can finish in time. But you can please show the slides. Yeah. Okay, good. Somebody says 265. Page 265 is there. Okay, very good. We can check it there, but please, I want you to okay, that I should go over. We are talking about the opening of the hymen. And we said, no matter how tired you are after delivering the woman, take some time and then examine the baby, especially the vulva, to ensure that the hymen is perforated in the center. And I said, congenitally, some babies don't have their hymen being opened. And in that case, if the midwife, if you see it, you can even use ordinary rectal thermometer, a new one. Position the baby in a frog-like manner. And you can use the thermometer to pierce it through gently. It won't cause any bleed, it won't cause any harm. Sometimes the membrane is just part of the membrane that is blocking it. You can perforate it as a midwife. If you know you can't, refer the child to the gynecologist or the obstetrician. They will do the same procedure that I'm teaching you. They will do the same, they use the thermometer, insect it, and then it opens. And then you advise the mother to use applicator. You know applicator, the applicator that we use to clean our ears. New one, we can sterilize it and then teach the mother that every morning when she's bathing the baby, she'll use it to dilate the orifice. Gradually, every day she does that. And then the orifice becomes patent. You see, because I'm not looking into anything, that's why you asked the question, but a different thing has come in. I hope you are following me. So that is it. Now, please. Okay. So that is for the hymen. Now, this hymen normally is broken during your first sexual intercourse. The first time somebody munched you, the person broke your hymen. And we are saying that, assuming the girl during the first sexual intercourse or during sexual intercourse, she becomes pregnant and she delivers, then this same hymen would then leave tags of tissue known as carunculi multiformis. Carunculi multiformis. That is the remnants of the broken hymen. Any question? Can I continue? Do you understand? Did you hear me?
Yes, sister.
Go ahead. Go ahead, sister. Please, somebody says she has a question. Ask your question, please. Which network has started? It has started
HAJIA.
from your end. Yes, sister.
HAJIA, please, if someone is born with the imperforate hymen and the person has sex, can it be broken then?
No, the
the
penis
hymen
cannot
be
open it. It will still be intact, and so penetration will not be possible. Yeah. Network. Yeah, Rahima is, I think I've answered your question. Yes. And
Yes,
I didn't even finish with the accumulation of the menstrual flow. When it fills up, every month she menstruates, she fills up to the vagina, then it can extend up to the uterus. Every month she will menstruate, and the vagina becomes full. But because there's no outlet, just because the midwife who delivered her didn't bother to examine her vulva for the perforation, for the opening. And so menstruation will continue accumulating into the uterus. And that one, we call it hematometra. You said, won't it smell? Where is the outlet for you to smell it? Hematometra will occur. And then the girl will start with fever. It becomes infected. Like we are saying, won't it smell? It will smell, Papa. It will smell really when they realize that she's not menstruating. Maybe they want to go to hospital, they want to do vaginal examination. That is where they will identify that the hymen is not even perforated, let alone her having going in for sex. A cousin of mine had it. She was in the secondary school, Form 2. I was then in the midwifery school. So when I came back, my sister was beating her that she's pregnant. We sent you to secondary school, you are pregnant. I also joined her. We started beating her. Yes, we started beating her. It was my brother, who wasn't a nurse, rather, came. When he came, said, why are you people beating her like that? And then my sister said, she's pregnant. She's pregnant. Since I came, she hasn't menstruated and blah, blah, blah. Then my brother said, send her to hospital for confirmation. You cannot be treating her like that. Don't do that. We are ashamed. We sent her to take hospital, only for the doctor to realize that she was having imperfect hymen. And when we were beating her, she said, sister, me cry me sex is that. Meaning I haven't had sex before. But you people think I'm pregnant. I'm not pregnant. Except that I've never menstruated before. You see? And it was there they detected that she was having imperfect hymen. And then they took her to theater, opened it, and they did it in their mini theater there. It was smelling proper. So somebody asked, won't it smell? This is the time you identify that, or you notice that it is smelling. Infection. She was feverish. Yes. Excuse me. Yeah, somebody said she witnessed one when she was in theater. Good. So it could either be hematocorpus or hematometra. And I'm sure because of the way it has become infected, they will have to put the girl on antibiotics, or because of somebody's negligence, or because of somebody's, I don't want to say laziness, but let me use it. Somebody's laziness. What prevented you from examining the poor girl, baby girl? How long will it take you? Not more than even 5 minutes. You are done with your examination. So these are the dangers. Hematocorpus leads to hematometra. Hematocorpus will, if it's not corrected, it will bring about hematometra. You know, metra refers to the uterus. Endometrium, so metra. So hematometra, meaning the blood has filled up to the uterus. Yes.
Please,
Yes,
please, Jennifer Che.
No, go ahead.
Please, with what you are saying, I also know one lady, secondary school, but I want to find out whether it's the same imperforated hymen or something. Every month, she will wrap her left hand that she's menstruating, and the whole fingers will be red.
That's an abnormal
And
situation.
we ask, why are we applying this? Okay.
It's an abnormal situation. There was a woman who was like that. Yes. You will only see the reddened fingernails. That's why she has menstruated. She delivered 6. It's an abnormal situation. But we are talking about, So that is the hematometra hematocorpus. Any question? Now, I'm still on the hymen. I'm still on the hymen. Let me finish with this hymen before you ask your question. With the hymen, we are saying that after delivery, it leaves the same hymen. I don't know whether I've mentioned it. The same hymen will leave tags of tissues known as carunculi multiformis. So that is the external part of the vagina. Ask your question so that we can move on to the microscopic structure of the vagina. Micro, that is the layers. Yes, sister.
HAJIA, please, you were saying that the hematocorpus is a situation where a girl menstruates from the uterus and it fills up to in the vagina. So, what's the definition for the hematometra? Per what you said the person becomes feverish, like it's been infected, right? So, like, I want to know the explanation better. Yes, please. So
for
please
the hematometra,
yes,
I said the same blood that is accumulating in the vagina. If still nothing is done about it, where nothing is done is if they don't make incision for the outlet, for the blood that has accumulated in the vagina to come out, every month she will menstruate and it will continue filling up and it will fill and fill the uterus itself. And that is where it attains the name hematometra. And because it has become infected, she was packed with fever and other things. Probably they want to rule out a pregnancy. In the process, then they will see that she's not even having an outlet to allow the blood to come, let alone becoming pregnant. And I think I cited my cousin's own as an example. But so while they opened it, the blood came out, the menstrual flow came out, and then every month she started menstruating. She has even delivered about 4 boys. So that is it. Any question, please? You are welcome, sister.
Yes,
okay, ask your question. Yes.
All right, please. Earlier on, you made mention that when the hymen is broken after childbirth, the remnant is called the parencular metiformin.
It is after delivery. After delivery, that's yes.
And I know that it's also breaks during your first sexual intercourse. So I want to know if after your first sexual intercourse, we can also call the remnant the parencular metiformin.
Hello, come again, please.
Yeah, please. My question is that Earlier on, you said that when the hymen is broken during the childbirth, the remnant is called the caruncular metiformis. And
Yes, I
I
said
believe
that.
that during your first sexual intercourse, the hymen
It will
breaks.
still break. Yes, it will
So I
break,
want to know
but
if
it won't
during
leave.
that. Oh, okay.
It won't leave tags of tissue until baby passes through the vagina.
Oh, okay.
Mm. It won't leave tags of tissue until baby passes through it there. That's where you get the remnants forming the caruncular multiformis.
Okay.
Is
Thank
that
you.
okay? Rosemary, are you okay?
Yes, please. I'm okay.
That's fine. So please, let's talk about the microscopic structure of the vagina.
Yeah.
Microscopically, please. Yes, sister.
HAJIA,
Yes,
please.
sister.
What about those that undergo cesarean section, like their first babies, they undergo cesarean section, and I mean that one, the baby doesn't pass through the, what do you call it, the vagina, so it won't leave that scar tissue there. So it still won't be called the caruncular metiformis, right?
No, but the issue is that have you forgotten the number of? Please let him pick this call.
Wow.
Oh, come to you. Oh.
Yeah, sister, go
I
ahead.
can't say for my dear. Come to about question, come to about.
Sister, if you're not careful, I'll put you in the waiting room.
I was asking that those that undergo cesarean section.
And then you're asking whether
they don't
get the caruncular multiformis. Have you forgotten the number of times that the midwife do V, especially when labor is doubtful? They don't know what kind of presentation, what kind of obstruction is this. You keep on doing vaginal examination, and then you also help in then widening out or creating the caruncula after delivery. Apart from that, also, look, the hymen, it is not only sexual intercourse that can break the hymen. Sometimes to the mothers, the postpartum mothers, ideally, we midwives are supposed to educate them to resist or to stop that kind of milk tin that they open and then they will be putting water into the vulva of the girl. If you ask them, they say there's wound there, they want to heal it. That alone is enough to break the hymen. I'm telling you. When the when a girl is among boys, she does a lot of things just like the brothers also do. She plays football, she jumps, she rides bicycle, she does a whole lot. Look, it's enough to break the hymen. It's enough to break the hymen. So that at that age, 6 years, 5 years, you buy bicycle for them. What do you think you are doing to her? You are helping her hymen to break. Because we said it is a thin membrane. And it is not inside the vagina. It's outside the vulva there. So it will break. So irrespective of the fact that, so somebody say, yes, I experienced it personally, good. The hymen will break. And sometimes to the children, because of lack of estrogen at that tender age, they get vaginal itchiness. And so they themselves will be fidgeting with the vagina. Especially when she scratches and at a point in time, her hand enters a hole. Then she knows, oh, there's a hole there. Then she will be fidgeting with it. It's enough to break the hymen. And then some mothers too, when they see that, that's why a group of girls, sometimes young girls, 6 years, 4 years, They will go and hide somewhere and they'll be fidgeting with their vagina. What do you think they are doing? They are lacking estrogen at that level. Estrogen helps to nourish the vagina. But at that level, their estrogen level is minimal. And so they begin to get vulvar itchiness. So they go and hide somewhere. This one will be fidgeting. They put their hand inside. Once they know there's a hole there, they put their hand there and then they'll be fidgeting with it. They are happy because the itchiness will go down. A mother sees it, she's angry. She's angry. Some of them become so angry to the extent that they will grind. What do you call it? How do you call those things? Those things that ginger. Yes. Some of them, out of anger, they will chew the ginger. Any grinding is grinding. They will chew the ginger and then put it inside the girl's vagina. Please, as midwives, it's our responsibility to educate our clients not to do that. Not to do that. Now we have known that it is lack of estrogen that is causing the itchiness in her vagina. What do you want her to do? She shouldn't scratch. So you put the ginger there. What have you done to her? You have introduced infection because out of anger, any unhygienic environment, you grind this ginger and go and put it in her vagina. You are blocking her vagina, fallopian tubes. If you are not lucky, she grows up and she would never miss her period. The fallopian tubes have been blocked by that ginger you introduced into the vagina. Yes, it's true. Your mother did something to you. Let's pray that you become pregnant. You see, once you block the fallopian tubes from childhood, that ends it. She will never miss her period. You see, midwives, we have a lot to do. We have a lot of work, a lot of education to give to our clients. Ladies and gentlemen, so let's end the hymen here and let me talk about the microscopic structure of the vagina. Please, can I continue? Please, can I?
Yes, sister.
Yes, sister.
Okay.
Yes, sister.
Yes,
Some of the grammar
you can.
like, yes, okay. So I'm starting from inside outwards. So picture a canal that you cannot see with your naked eye. Even when the woman passes her vulva, you can still not see the vagina. So it's an imaginary tube that passes through the plane of the pelvis at a right angle, just because of the way the cervix projects into it. Now, the inner lining of the vagina. The inner lining of the vagina is made up of stratified epithelium, stratified squamous epithelium. Stratified squamous epithelium lines the vagina. It is drawn into folds known as rugae. Rugae. The essence of the rugae is to help with expansion of the vagina during sexual intercourse and then during childbirth. So that had it not been the rugae nature of the inner lining, you can imagine the sort of pain that we would have been experiencing when during sexual intercourse. But the rugae has made it in such a way that God has made it in such a way that it stretches, it expands to allow for easy penetration. That is why no matter the size of the penis, you can accommodate it. You can receive it, you can accommodate it, and enjoy your sexual life. So that is the stratified squamous epithelium. Now, being stratified epithelium, it can withstand wear and tear. Can you imagine? This stratified epithelium, had it not been that, and it were to be any cuboidal or ciliated or that kind of thing. But being stratified, it can withstand wear and tear. That is why sometimes after sexual intercourse, in no time, 3 days time, you can still go in for it. Yes. You can still go in for another sexual intercourse because the stratified epithelium is said that it can withstand wear and tear. That's why after delivery, after 6 weeks after delivery, the woman can still go in for sex because despite the wear and tear over there, she can still. Yeah, somebody is asking whether the rugae can be seen on inspection. In the multiparous woman, it can be seen when you use the speculum. When you use the speculum, you can see the rugae. But then one thing is that with the multiparous, as time goes on, the rugae nature disappears. The rugae nature disappears, and the entire canal becomes smooth. But it is so obvious in the primigravida woman. It's more obvious in the primigravida woman. Okay. So that is the inner lining of the vagina wall. Next
Yeah,
to
and Hajia, when after the what do you call it? After the second stage and third stage, you deliver the placenta and you are inspecting to see whether there's a tear. Like it's very obvious. You can see it.
Yes, yes. Especially because it has been subjected to blood supply
Yes.
to that part
Yeah.
during pregnancy. It becomes
At
so
times
glaring.
after delivery, you can also see it.
Yeah, sometimes you can see. Sometimes you can see. But is it the rugae that we are interested to see, or we are interested in seeing whether there's a cut? So that you see.
Is
So that is
the tears that you are inspecting to see in order
see,
to
yeah.
suture and to prevent a postpartum hemorrhage. But once you are
Good.
inspecting you, it's very obvious there.
There. Okay, that's good.
Yeah.
That's good. Okay. So let's see the next layer. Let's see the next layer. Next layer two. I said I'm starting from inside outwards. Outwards. So the next layer to the stratified epithelium is connective tissue. Connective tissue, which contains blood vessels, nerves, and lymphatics. And in fact, the blood supply to the vagina is very, very rich because of the activities that it does. So I'm talking about connective tissue containing blood vessels, nerves, and lymphatics that supply the vagina. Next layer will be muscular layer. Next layer will be muscular layer. And the muscle layer is made up of inner circular fibers, then outer longitudinal fibers. The inner circular fiber and then outer longitudinal fibers. So the muscle layers are in two folds for the vagina. The next layer is the pelvic fascia, so that the entire vaginal tube is covered with pelvic fascia. Any question, please? Any question? Yes, sister.
Please, can you go back to the next layer, which is the muscular layer? You said it's made up of two folds. I didn't get.
I said inner circular fiber, outer longitudinal fibers.
Okay, thank you.
The muscle layer, yes. The muscle layer. Please, those of you who can check from the slides, it has inner circular fiber and then outer longitudinal fiber. And apart from this, the entire vaginal tube is covered with pelvic fascia. It is enclosed in a fold of pelvic peritoneum known as pelvic fascia that protect the vagina. Are we okay? The vagina has a pH of 4.5. Some books are saying 3.8 to 4.5, meaning that the vagina acidity, the vagina acidity is high. The acidic medium, the pH, is very high. That is 3.8 to 4.5. You say the network is very bad. Are people not hearing me? Hello?
Haja, please, we can hear you very well.
We
can hear you, Haja.
Hello. It's shaking.
Yeah.
It's not
We can
breaking.
hear.
Yeah, okay. Thank you. So those of you who cannot hear, can you shift yourself a little bit from where you are? Probably it is your own network. So that when you shift yourself a little bit, it may be clearer than it used to be. Try it that way, please. So that is the microscopic structure of the vagina. Any question? I was talking about the pH of the vagina. I say it's 3.8 to 4.5. In the slides is 4.5. But latest books are talking about 3.8 to 4.5. So it's not alkaline, it's acidic in nature. And so let's link it to
We also received some.
Go and stay in the waiting room there and do your preaching. Let's continue. So that is the pH of the vagina. And let's link it to midwifery. In relation to midwifery, mothers are advised not to apply local herbs into the vagina. Mothers are advised not to apply local herbs and other medications into the vagina unless maybe there's infection. There's infection and you are using maybe vaginal pessaries to apply in the vagina. Other than that, some are fond of applying some local herbs into their vagina. And for whatever reason, I conducted a research somewhere and then it's like the responses were that you yourself, you know the response. Why do you think the mothers put local things inside their vagina? Please come out with answers.
Why for vagina, Hajia?
Yes.
Hajia, to clear infections.
To clear, and that is the idea, to clear infection.
Yes, sometimes.
Vaginal tightness.
For vaginal tightness, that is the rationale.
Thank you. For tightening and sweetness.
They are saying that when you put and what are some of the things that they put there in their vagina? They grind and put in the vagina. What are some of the things? You look at things. Pepper. Okay. So they have so many names. You see, they are putting all these things there. You ask them and they say they want to tighten the vagina. Please, midwife. Yes, they say the husband will enjoy you when you apply those things. Please, midwives, we have a lot of work to do. We have a lot of education to give. Tell those mothers who have been doing that to desist from it, to stop it. Teach them, if they want to tighten their vagina, teach them how to do the Kegels exercise. I keep saying that it is the only exercise that a woman does and nobody sees you doing exercise. You can be eating and doing it. You can be in the lecture hall as you are in the lecture hall now. You can do it, nobody sees it. When you are sleeping, you can do it. When you are walking, you can do it. You are at work, you can do it, and nobody sees it. So teach them how to do the Kegels exercise instead of putting local herbs there. Let them know the dangers associated with these local herbs in the vagina. It causes cancer of the cervix. Researchers have seen that. That if you are the type who have been putting the pepper, the quintia, and all those things inside your vagina, you are exposing the vagina to or the service to papillomavirus, to cervical cancer. So we have to educate them not to do that. Instead, they should do the Kegels exercise. And I think we all know how to do Kegels exercise. Every midwife knows how to do Kegels exercise. Unless somebody tells me she doesn't know. But we all know how to do Kegels exercise. So that is it. So teach the mothers to do that, so that it will prevent them from applying these local things in those pepper and those things. In fact, they are meant to steam meat and fish. Those things, all those things are meant to steam fish, meat, and prepare soup. In a way, are you going to steam your vagina? No. Are you going to steam your vagina for you to put all these spices there? Meanwhile, at the end of it all, it will create a serious disease for you. Meanwhile, there's a simple Kegels exercise that will help you to tighten your vagina outlet if you think there's some widening somewhere. Do the Kegels exercise. Any question, please? Any question?
HAJIA,
Yes,
please,
sister.
is the warm sit bath advisable?
Is what?
Warm sit bath. Is that too advisable?
Hot sit bath after delivery.
Warm sit, yes, please.
Warm.
No, for
Yeah,
the tightening of the
vagina.
Yes,
The best way to tighten your vagina is the Kegels exercise. If you do it well, you don't need to put anything there. If you do it well, you don't need to put anything there. Now, the issue is that when you tighten the vagina, have you forgotten that the penis that is coming to enter there doesn't contain any bone? It is part of the man's flesh. It is part of his body. And so when you make the vagina so tight like that, per my findings in the research that I conducted in a certain village, the men responded so well. In fact, it was the chief of that town who even said it. He said, Madam, when they make the vagina too tight like that, we also struggle. We have to force to enter. At the end of the day, you end up with abrasions on your penis. And that is what the man said. He said, at the end of the day, you end up with severe abrasions on your penis that you need to dress. And that is the word he used. Was it enkuda? And it's like, I don't want to speak tree, but that is what he said. I'm only quoting the man. Was it a crow? I feel now better than the word mia. That is what. So you create wound on the penis, and then later you have to take your time to make sure that it heals. Why do you have to subject yourself? And that is why when you make it vaginal tightness, you make it so tight like that. At the end of the day, what happens? The man is entering and you are in pain. He passes here and you are complaining. He goes up, we. He passes there, he passes, we. Who is causing you? We. Who is causing that? You yourself. You yourself, you are causing that. Because you think it should be tight for the man to enjoy. Why should you inflict pain on your body for somebody to enjoy? And meanwhile, they didn't say they like it that way. Did they? Did the man say he likes it so tight like that? Yes. Forcing his penis inside. Forcing the force that will bring about aggression. And let him tell you, that is what contributes to the transmission of HIV/AIDS. We all know HIV is a sexually transmitted infection. Yes. But what you contribute to a spread is what we are doing now. Because at the end of the day, if the woman is, oh my goodness. At the end of the day, the man will have to. At the end of the day, she'll go to the waiting room by all means. She'll go to the waiting room. You dare me. She has muted herself.
Sister, don't worry, I've put her in the waiting room.
Don't put her there. You bring her back. I think she muted herself before you put her there. Bring her because you don't know when she's going to spread infection elsewhere or getting infection somewhere. So I'm saying that the tightening of the vagina contributes to the spread of sexually transmitted infection through the medium that I'm describing. So that if the woman is infected and she has made the vagina so tight and the man is forcing to enter with the penis, there will be abrasions on the penis. Straight away, the part that has been bruised or where the abrasion is, that is where the infection, the microorganism, the HIV virus, is going to pass from the woman to the man. In the same vein, if the man is also infected, per the abrasion that you have created on his penis, microorganisms, the germs, the HIV virus will come from that bruised area. And then because you have also created an avenue for the infection to get there, then you get yourself infected. Is it advisable? Is it good to do that instead of doing Kegels exercise? Ladies and gentlemen, I think we are all going, we have a work to do. We need to educate our clients to desist from this kind of practice. It's not healthy. It rather exposes you to infection. Okay, so now let's talk about blood supply to the vagina, and then we'll talk about the relationship. Can I continue? Ladies and gentlemen, where are your men? They are not talking. Oh.
HAJIA.
Yes, sister.
Yes.
HAJIA,
Yes.
please, what about the Ken Swebe?
The
After
Ken Swebe.
delivery? Yes.
Potassium permanganate. Potassium permanganate.
Yes, sister.
Yeah, when you put potassium permanganate in smaller quantity in warm water, and when there is no episiotomy, and I repeat, if the woman hadn't gone through episiotomy, then she can do the sit bath. But if she had an episiotomy given during delivery, yes, I should open it for you. Thank you. Go and give it to. Go and tell Auntie to give you a cup. Ogu. Tell Auntie. Tell Mommy to give you cup. Cup. Okay. So the potassium permanganate, I'm saying, if she had an episiotomy, then she shouldn't use the hot sit bath. Other than that, the clomic that was used to suture the episiotomy will melt, and the wound, the incisional site will gape. It will gape, and we haven't done anything good for the client. But without the episiotomy, then she can do the hot sit bath. Just lukewarm, and then she sits in it. It promotes healing. That one is fine. But once stitches are inside, don't tell them to do sit bath. Yes.
HAJIA, please, what if the client has gone through CS, cesarean section? Can the mother use the potassium
Please, I'm not
permanganate?
hearing you. I'm not hearing you well.
Please,
I'm not
I'm
hearing you.
saying
If somebody heard her, can you repeat it for me?
Hello, HAJIA.
Yes, sister.
I'm saying that what if the mother undergoes CS? Can the woman use the potassium permanganate?
Why do you think she needs the potassium permanganate?
I don't know. I have a friend when we were in school, and then she told me that when she undergone CS, she was using the potassium permanganate. That's why I'm asking.
I think you have to educate her to maintain personal hygiene, eat well, change the perineal pad at frequent intervals. That ends it. It's okay. If she eats well, early ambulation, she ambulates early enough, then it will promote drainage of lochia. You teach her how to do the pelvic floor muscle exercise. It will promote drainage of lochia. She eats well, the worn out tissues will be repaired. So there's no point using the hot water for CS patients. Okay. That is so. Whoever is calling, is it my phone that they are calling? Who is this person? So please, let's continue. Let's see the blood supply and the relationship of the vagina. Please, those of you who are leaving, don't leave the page, don't leave the Zoom. Where we have reached, you are likely to get some points there that will help you. That will be very, very beneficial to you. So let's see the blood supply to the vagina. The vagina is supplied with, in fact, all the organs that are in close contact, that are in relation with the vagina, they supply it with blood. The first supply is from the vaginal arteries. Then the pudendal arteries from the vulva. Vesical arteries from the bladder. Hemorrhoidal arteries from the rectum. Uterine arteries from the uterus. They all supply the vagina with blood. Because the work that is done is very tedious. So whoever is in contact with the vagina will make sure that it supplies it with blood so that it can continue and maintain the good work that it is doing. So that is the blood supply. Venous return is from the corresponding veins, so that you get the vaginal veins, the pudendal veins, uterine veins, vesical veins from the bladder, and then hemorrhoidal veins from the rectum draining it. Lymphatic drainage is into the inguinal glands. Then is it external iliac? Please check the lymphatic drainage for me. Who says I'm moving fast? Am I fast? I'm not fast too. I'm giving you the slides and I'm explaining things to you. I don't even have this thing. Okay, which aspect did you not hear? Because I've been spoken about the relationship. There's a blood supply that I'm talking about. And I said all those organs that are in contact. Internal iliac glands, yes. Blood supply from the internal iliac. No, the lymphatic drainage is into the internal iliac glands. Okay. So we said I was too fast. Let me slow down. I'm talking about blood supply to the vagina. Sacral glands, yes, we said that. Okay. Let's go over it. So I'm saying that blood supply to the vagina is from the vaginal arteries. Is that okay? This one too, am I too fast? Blood supply to the vagina is from the vaginal arteries. Is that what you want? Then uterine arteries. Then I said vesical arteries. Somebody say it's too slow. Then the vesical arteries is coming from the bladder. It also supplies the vagina with blood. Then I mentioned hemorrhoidal arteries. The hemorrhoidal arteries are in the rectum. Because of its proximity to the posterior wall of the vagina, it also supplies it with blood. Then I think that is all about the blood supply. Venous return is from the corresponding veins. Lymphatic drainage is into the sacral glands. But I read somewhere inguinal glands are also part too. Yeah. Okay. Let's talk about the relationship. Please, I'm doing the talking alone. It's not good. So tell me, what are the relationship of the vagina? The structures that relate to the vagina, what are they? Mention them before I call your name. Aisha Mustafa, mention the relationship of the vagina. Aisha. Yes, go ahead. The one whose hand is up. Is it Doris Aban?
Yes,
Go
sister.
ahead.
Anteriorly, it is the bladder, and the posteriorly, it is the rectum.
Thank you. Yes, go ahead.
Sister.
Yes, sister.
Sister, please, anterior is the bladder. Posterior, we have the port of Douglas superior. Rectum central. And the perineal body inferior.
Good. Good. So yeah, somebody's hand is up. Give to Mensa.
So I just spoke.
You just spoke. Oh, okay. Thank you very much. Okay.
HAJIA,
So the
please,
relationship. Hey, your line is taking you out to stand somewhere. Stand.
Sister, please, subtrus.
Okay. Okay.
The bladder and then the urethra.
Okay. Your line took you off. So where you started from, we didn't hear. Let me just make a summary of all that you have said. We are talking about the structures that are in contact with the vagina. So we are using superior, inferior, anterior, posterior, then lateral, medial. So let's start from superior. Superiorly, the uterus and the cervix are in contact with the vagina. Inferiorly, structures of the vulva, they relate to the vagina. Then anteriorly, the upper half, so the anterior aspect, please divide it into two. So you get the upper half is in contact with the base of the bladder. Then the lower half is in contact with the urethra. So you see that the urethra is embedded for anatomical system for midwifery sake. Note that the lower half of the anterior part is in contact with the urethra. So look at the proximity of the urethra to the vaginal orifice. We said you can locate the urethra about 2.5 centimeters above the vaginal orifice. They're very close, very, very close. Okay. So that is the anterior relation. So you divide the anterior into upper half and lower half. Upper half, base of bladder, lower half, the urethra.
HAJIA, please,
now,
can you go back
to the
from the superior to the anterior, because you were going fast and the network too kept breaking.
It's those who heard me. Can somebody repeat it for her for me?
Yes, sister. Please,
Yeah, go.
HAJIA said, superiorly, we have the uterus and the cervix. Inferior, we have the structures of the vulva. Then anterior, the base of the bladder, forms the upper half of the urethra. And the urethra is embedded in the lower half of the
Vagina.
Vagina, yes.
Good. Please, the one who asked the question, is it clear now?
Yes,
is
please.
It okay?
Thank
yes,
you.
That is good. So let's go to the posterior. Posterior aspect, that's the posterior vaginal wall. which the posterior vaginal wall to divide it into 3 portions. The posterior vaginal wall, divide it into 3 portions so that you get upper 1/3, middle 1/3, lower 1/3. Can I continue? So the upper 1/3, that is the upper third of the posterior vaginal wall, is in contact with the uterorectal pouch. Uterorectal pouch, also known as the pouch of Douglas. The pouch of Douglas. Then the middle third of the vagina is in contact with the rectum. It's in direct contact with the rectum. That's why when the rectum is loaded, when the rectum is loaded and baby is coming, baby will use the face to strip the feces out. It's very, very close. Then the lower 1/3 portion of the vagina is in contact with the perineal body. Is it okay? The posterior relations of the vagina. Is it okay? I say divide it into 3 segments. You have upper 1/3, middle third, or central, and then the lower 1/3. Posteriorly, I said the upper 1/3 of the vagina is in contact with the pouch of Douglas. With the pouch of Douglas. Then the middle third. The middle third is in contact with the rectum. Then the lower third, that is the lower 1/3, is in contact with the perineal body. Any question? Any question, please? Please, I'm done with the description of the vagina. What is the nerve supply to the vagina? Anybody? Jennifer Anderson. Jennifer, what is the nerve supply? The nerve that supplies the vagina.
The sympathetic and the parasympathetic nerves.
Yes, the sympathetic and parasympathetic nerves from the leaf Frankenhauser's nerves. Please, you better mute yourself before you bye-bye somebody. So that is it. That is the nerve supply. I think I forgot the nerve. That is it. So, ladies and gentlemen, we are done with the description of the gross structure, the situation, the shape, the size, gross structure, microscopic structure of the vagina. It's left with the functions. The functions of the vagina. Let me call somebody to tell us the functions of the vagina. Attack Nama. Attack Nama. What are the functions of the vagina? Priscilla. Priscilla, tell us the functions of the vagina.
HAJIA, please. It receives the erected penis and ejected sperm during sexual intercourse.
Good. Any other function of the vagina?
And it is an exit for the products of conception.
Great. Any other function? Priscilla Dubuachi, yes. Priscilla, go ahead. Any other function?
It helps to support the uterus.
It helps to support the uterus superiorly.
It helps to exit from menstrual flow.
It is an exit for menstrual flow. Good.
It is a channel through which.
It is the exit of the fetus.
The exit for the product of conception. Good. the exit for product of conception, the baby, the fetus, placenta, membranes, amniotic fluid, whatever.
It's an
So
entrance
that is
to
it.
spermatozoa.
It's an entrance for spermatozoa.
It also helps to prevent infection.
Yes. Yes. It helps to prevent infection. How does the vagina prevent infection? How
Because
does the
of the
vagina?
acid content.
Somebody should say it well. How does the vagina prevent itself from infection? It's a full question. So answer it.
Please, it's
HAJIA,
contains
please,
in
it is
acidic
due to the
medium.
presence of the lactic acid, which is produced by the Dondline bacilli.
The word is dodalen. Dodalen's bacilli. Dodalen's bacilli. Go ahead. So now start again. Start afresh. Start afresh, please.
Okay. Please, it is due to the strong acidic medium of the vagina, which is due to the presence of lactic acid, which is produced by the HAJIA, how did you pronounce this again? The Dondline bacilli. Thank you. Which acts on glycogen, which is found in the vagina, to prevent infections.
Say it again. Say it again.
Please, it is due to the strong acidic medium of the vagina, which is found in the vagina, due to the presence of lactic acid, which is produced by the Dondline bacilli, which then acts on glycogen, which is found in the the vagina, to prevent infections.
Thank you very much. Please, wherever you meet this question, you should try to do justice to it. How does the vagina prevent itself from infection? Okay, so that is it. Please write it down. I want you to read on discharges of the vagina.
Please
write it down. Write it down. The various discharges at the vulva coming from the vagina.
Sister, please, can you take the question again? The assignment.
Oh, I said, describe how the vagina prevents itself from infection. Describe it. Okay, so we are talking about vaginal discharges. You know, we have, I think we did this thing when we were treating the vulva. Hello?
Hi.
Hello? I think we treated it. Yeah. I've now remembered that we did it when we were treating the vulva. So the discharges you should know. We talked about whitish kidney discharge coming from moniliasis infection, or candidiasis. It's the same thing. You can choose to call it monilia infection or candida infection, which is called by the Candida albicans. We said it, we treated this topic when we're doing the vulva. We don't need to go over, so that is it. The discharge, unless somebody has
please, for the sake of me that got late admission, we just joined. So can you please go over?
Okay. So we said the discharges of the vagina. We have the whitish kidney discharge, which has a foul smell, indicating candidiasis or moniliasis. It is caused by Candida albicans, that's the organism. It is a fungal infection. It's a fungal infection. And the symptoms are vulvar itchiness or vaginal itchiness. The individual woman scratches the place and becomes inflamed. The part becomes inflamed. The treatment is Nystatin vaginal pessaries. The treatment is Nystatin vaginal pessaries. So that is the Candida albicans. Please, I hope we are all using Stevia veras. It's there. It's inside the Stevia veras.
Yes, sister.
Yes, it's all there. The Stevia veras have tabulated it nicely, beautifully. So you can check from the Stevia veras. Then we have Trichomonas vaginalis. That's a protozoa infection. It's part of the SCIs. And it is caused by Trichomonas vaginalis, the protozoa. The discharge is yellowish, greenish discharge. Yellowish, greenish discharge. And it's sometimes offensive. It causes itchiness of both the vulva and then the vagina.
Oh, tell me, so now you free, you want to mab me. Ah, Trey.
So that is it. Then we have Neisseria gonorrhoeae, that is gonorrhea infection. The discharge is a greenish, yellowish, frothy. It's like a foamy, frothy, foul smell discharge. It is caused by an organism known as the Neisseria gonorrhoeae. Neisseria gonorrhoeae. That is it. And it has, the discharge looks like pus. It is pussy in nature. The discharge that comes from the vagina, if there's gonorrhea infection, is pussy in nature, but then it's yellowish, greenish, and it is frothy. That is the difference between the gonorrhea infection and that of the trichomonas. Trichomonas is not frothy, but gonorrhea infection is frothy. It's like a soap lather coming from the vagina. And then we have, those of you with the Stevia veras, hoping it is there. And I think it's not it's not part of the slides, but it's in Stevia veras. So that is the infect.
Chlamydia.
Chlamydia. Chlamydia is also another type of sexually transmitted infection. What about the chlamydia? What of chlamydia?
The Stevia veras is saying that Chlamydia trichomonas, a small parasitic unicellular organism.
Yes.
The vaginal discharge is mucopurulent.
Mucopurulent.
Yes, cervicitis and pelvic inflammatory disease often reoccur as a consequence of the infection. Please, should I go on? The patient complains of dysuria. History taking may elicit that the woman's sexual partner has been or is being transmitted for non-specific urethritis. Diagnosis is made when the laboratory detects Chlamydia trachomatis in vaginal smear.
Okay. Okay.
What do you think of it?
Okay. Okay. Thank you very much. I think so far so good.
Yeah, we have bacterial vaginosis too.
Bacteria.
Vaginosis.
Okay. Read that one and let's hear you. Once it is bacterial infection. Go ahead. Oh, read it. Just read. Hello. Hello, sister.
HAJIA.
Yes, sister.
I muted myself.
Mm-hmm.
The normal flora of the vagina is replaced by the overgrowth of a bacteria.
Mm-hmm. Yeah, but
Hello.
one thing. Hello, we can hear you. Go ahead,
Okay.
please.
Okay. I thought I muted myself again.
No.
Oh,
You
okay.
didn't mute yourself, so go ahead.
I said with the bacterial vaginosis, the normal flora, that's the lactose bacillus, is reduced and replaced by overgrowth of other bacteria.
Okay, that's good. But one thing that we have to advise our mothers to know is that the vagina has its own normal flora. It has normal organisms that are in the vagina. They are there, they serve as a defense for the vagina. So that if you should introduce any local herbs, any medicine, any unhygienic clothing, then you are changing the medium of the vagina. You are changing the pH of the vagina. And that will in turn become something infectious. It becomes a disease for you. For example, people think that leukorrhea, I think you all know leukorrhea, excessive vaginal discharge during pregnancy. The woman feels so uncomfortable for experiencing this plenty discharge of the vagina. But it is normal. We have to educate in relation to midwifery. Educate the mothers that you shouldn't worry. It will go by itself. You shouldn't apply local things there to clear that leukorrhea. It will go by itself as pregnancy advances. Because of the high level of estrogen working on the vagina, creates this leukorrhea. And so they shouldn't worry. You should rather wash the place, the vulva, and not even the vagina. You should wash the vulva with plain water. Just plain water is enough. It's enough. Because some of the soap that we use can also turn the normal flora to become infectious. It will turn into a different condition. For example, if you use this harsh soap to wash the vagina, you destroy the staphylococcus, and then the vagina is the normal flora there. You destroy them. And so it turns into a different condition for you. So tell them, when they are bathing, they can bath the vulva, all right, but they shouldn't tamper with the vagina. And especially in relation to midwifery, if a client comes to you and complains to you that, Madam, Auntie Midwife, it's like I'm not able to achieve pregnancy. I've tried, I've married for 3 years, 4 years, I haven't become pregnant for my husband. Find out from her whether she has been douching, whether she has been introducing her hands in the vagina in an attempt to wash there. Tell her, advise them to stop washing the vagina. The word is stop, S-T-O-P, stop washing the vagina. Rather, they should wash the vulva. When you leave the vagina alone, without fidgeting your hand there, you stand a chance of achieving pregnancy. I'm telling you, if any of us is having that challenge, give yourself some trial and then see if the pregnancy won't come. Because when you leave the vagina alone, the environment is no more hostile. It rather permits, it rather attracts, it rather promotes the spermatozoa to pass through the acidic medium and then go and meet the egg. And pregnancy can be achieved, inshallah. But if you think that because the place has become messy, right now among you, somebody is even thinking, hey, Ajia, what should you are teaching, but then saying that we shouldn't watch the vagina there, and you are doubting. Don't doubt. Please don't doubt. Give it a try and see if you wouldn't, without taking any drug, you will achieve pregnancy. You achieve pregnancy because you have made the environment friendly for sperms to pass through. But if you put those things there, the place becomes so hostile and sperms cannot pass through to go to the service. You get up and the whole sperms come back and you are worried. Ladies and gentlemen, please, this brings us to the end of the description of vagina. Next week we have our quiz. We wanted to have it now, but I wanted to finish with the vagina before. Okay, so that is it. I have a class with the other group.
HAJIA.
Yes, sister.
HAJIA.
Yes, madam.
Describe the how the vagina prevents the infection. Is it assignment or we should go and read on?
I said reading assignment. I said that.
Oh, okay. Okay.
I said reading
HAJIA, please, I want
assignment.
to ask a question.
Ask me. Go ahead,
please,
sister.
I want to find out those who use tampons for their menses, will it inhibit pregnancy? As we are saying that they shouldn't fidget the vagina.
The tampon. I don't know, the tampon. When you use a tampon, what happens is that you are not able to sustain the moisture, the number of perineal pad that you change in a day. Some people use it, but if only it is sterile. But preferably, you should leave the vagina alone. Leave the vagina alone, no. Because we said it is a potential canal. It's a potential canal, so that if there's any secretion, it will come out by itself. When you get the menses, are you the one who put your hand inside the uterus and then start scooping the blood out? No.
No.
It comes out by itself. So that if there's any discharge, if there's any secretion, it will come out by itself without you putting your hand there. So if you want to achieve pregnancy, please bet me. I say leave your vagina alone and see if nature wants to work for you. Leave it. So that if you are not putting your hand there, then it will not allow anybody to be putting their hand also there. No pesado. Don't allow him to be fidgeting with your vagina because you yourself, you don't want to put your hand there. Why should you allow him to? You tell him that, please. Apart from that, you don't like perfume in the evening. Ladies and gentlemen, that is it. So the vagina, as for the vagina song, everybody knows it. HAJIA formulated it. And it's all over the nursing training schools, everywhere. Everybody knows how to sing. So we don't need to go over it. You all know. Other than that, vagina song. So everybody knows how to sing. Who doesn't know how to sing the vagina song? But you all know it, isn't it?
No, HAJIA.
Yes,
sister.
HAJIA, no.
Hey, the vagina song.
Sister, I want to hear from you.
Okay. You want to hear from me, then tell others to keep quiet. Original composer, yes, I compose it. Those who know how to sing, keep quiet and let me sing so that those who don't know can also learn. I thought everybody knows, so I didn't want to sing it. So then it goes like...
They know they are pretending.
They know. Okay. So it goes like this. Vagina Vagina is a potential canal. Oh, vagina. Vagina is a potential canal. The cervix projects into the vagina at a right angle, forming four fornices. Anterior fornix 7.5, posterior fornix 11.5, and the two lateral fornices. Inferiorly, it has a hymen, and when it breaks, forming carunculi, materiformis vagina, vagina. It's a potential canal. Okay, so that is it. Okay, so in case you forget, you say describe with a well-labeled diagram. Describe the anatomy of the vagina, then you think and you remember, and then that is so. Okay, so please, since we don't have any question, you are group A.
Hello, Hajia.
Sister, we are group A.
Come again.
We are group
Yes, sister.
A.
And you are group A.
Hajia,
Okay. Your
Hajia,
line is
please.
breaking.
Hajia, please, it's fine. We have
I had
15
a late
minutes to prepare
admission.
for the pregnancy.
You have pregnancy. Okay. Okay. Then I'm also waiting for the group B. Yes, sister. Yes, sister. Please, somebody is calling
Hajia, please. I had late admission, so this is my first time of joining. So if
Why
I'll be
did
very
you
happy
join
if
at
you
this time?
send me the slides.
I'll tell your course rep. He will send you the slides. I'll send it to them.
Hajia,
All right.
Hajia, please, I have a question. Hajia, please,
Yes.
it's about my sister. She's an olive, and she was saying that sometimes she can see the vaginal rugae. She went to the hospital, and the doctor said, "Oh, there's nothing wrong with it." But she called me and asked me, so I wanted to find out.
No.
Please.
Let her come to your facility and do spec examination to see whether it is a rare rugae that she sees. For all you know, sometimes there's a prolapse of the anterior vaginal wall. So you have to do spec exams for her. Huh?
Okay.
Let her come to your facility. She lies in the lithotomy position. If she's not shy of you, then tell her that she should push deliberately.
Yeah, I've done it, and I realized it was the rugae.
No, then there's nothing wrong. There's no problem. If it is the
But she was
rugae.
saying sometimes she experienced frequent vaginal discharges. That's infection, so she don't know if it can attribute.
Let her do vaginal smear, high vaginal smear.
Okay.
Especially if it is associated with itchiness.
No, nothing. No.
And then tell her if she's using the achloric nails, she should take them out. You should remove those achloric nails because it's
She's
suffering
not
organism
using
and that
some.
is. Okay, that's
Hajia.
All right, thank you very much.
You are
Hajia.
welcome. Yes, sister.
Hajia, please,
Yes, sister.
I don't know my group. I don't have any group. Can you, because today my network was worrying me, so I joined very late. So I don't know where they have shared it. Okay.
Hajia.
Thank you very much. So the group B, I'm going to start them. Yes, sister. Yes, sister.
Please, Hajia, please, I want to contribute a little.
Go ahead.
I remember I also made a research about the douching, the creams and the herbs that they are using, although it alters the pH of the vagina, but mostly its main function is, the vagina is a mucous membrane, and what it does is it dries most of the moisture of the vagina, and hence rendering it very dry, which in the end tightens the vaginal lumen. Hello.
Please, you said you were contributing. You stopped halfway.
No,
Oh,
Hadia, I remember I also made a research about the bulking creams,
That's good.
the Kea
So now,
and the tightening creams. Although it alters the pH of the vagina, but its also main function is, the vagina is a mucous membrane, and therefore it dries most of its moisture of the vagina, rendering it very dry, and in return tightening the lumen of the vagina.
So you think it's the best? Please don't encourage anybody to cause any dryness in her vagina. That would be a very bad education. Don't encourage that. If it dries the vagina, should the vagina be dry? The normal thing is vagina should be warm and moist. Please. The vagina should be warm and moist. Right now, put your hand inside your mouth. You, the one asking the question, put your hand inside your mouth and bring it out. Do that
Please,
and let
I
me
wasn't
continue.
asking. I said I was contributing. That is why
No.
most of the ladies are applying that tightening creams and the herbs.
No, I'm only telling you so that when you get that group of people, you educate them. I say you put your hand inside your mouth and bring it out. Have you done that?
Moist.
It's very
Yes,
moist. That
Father.
is how the vagina should be. The vagina, there's no water stagnating there. But once you put your hand there, you saw that it was moist. That is how the vagina should be. It should be moist and warm all the time. But people think they should clear that moisture from the vagina. And that's why they're putting all these things there. And we are saying it is not good. It will expose you to infection. So don't do it. So you have to educate the mothers to stop douching.
the groupies are waiting for you.
They are waiting for me. Thank you very much.
HAJIA.
Thank you very much. Hello, sister. You on
Sister,
this
please.
note.
Sister, please, I want to ask, when is the quiz coming on?
Poprio.